Aloha, my name is Dr. Justin Carnate. I'm a licensed marriage and family therapist in the states of California and Texas, which means I can work with people throughout these states. I decided to make a video just to kind of remarket myself and also to share my approach to therapy. My approach to therapy is very collaborative, which means I will meet you where you are, depending on your needs for therapy, why you're coming to therapy, for example, maybe for depression, anxiety, trauma work, grief and loss, maybe some life transitions, things that are happening in your life that are causing you to develop some symptoms that are causing distress or whatever it may be. What I would like to say too is whenever I think about the work that's done in therapy, the one thing that is really important is the therapeutic relationship. So imagine your friends, your family, you won't share these things with them, these very vulnerable things with them, unless you trust them, right? So in order for our relationship to work, in order for therapy to work, you have to trust me. So I really put a big emphasis on the therapeutic relationship in order to reach these goals that you've come to therapy for. Another thing that I wanted to mention is that the one thing I always highlight is the importance of accountability and consistency. If you were to work with me, you would probably just see me maybe once a week, once every 2 weeks, maybe once a month. That is only 15 minutes out of the entire day. So what you do outside of therapy is really important. Holding yourself accountable, practicing the skills or techniques that we talk about in therapy, maybe even practice in therapy, practicing outside of therapy. Rather than assuming, oh, just because I attend therapy, things will get better, things like that. You really have to do the work outside of therapy and inside. Consistency. Not only just showing up to therapy, but also showing up for yourself. Right, what are you doing to help you reach these goals that you've come to therapy for? What are you doing to take a step forward? Knowing that sometimes, you take a step back and that's okay. Growth and progress is not linear. Sometimes there's steps back and then there's leaps forward. It really just depends. And that's okay, right? A big part of therapy and doing your own work is having self-compassion towards yourself, knowing that it's okay to take steps back. It's great to take steps forward, but don't be so hard on yourself, right? If you feel like we'd be a good fit, if you feel like you'd want to know more about my therapy approach, reach out to me. We can schedule a consultation and go from there. I look forward to working with you.